this is really interesting. I want to tell you this story. I feel like I made a discovery in the middle of working in the ER, testing people with this rapid COVID test. I'm ER Dr. Larry Burchett, working on the front lines of this COVID thing. When we got the rapid COVID test, before we got that, it took a couple days to get the results. So everybody that came in with a cough, we just assumed they had COVID and sent them home and said, quarantine, wait for your results and go from there, right? But then we got the rapid test that took 1 or 2 hours to get the result. And so I could get the result and think back to that person and go, oh, they had these symptoms. Oh, that was COVID. Oh, they had typical cough, body aches, fever, COVID positive. Okay, that's what COVID was. But something interesting happened in there where all these people would come in with these respiratory symptoms and we would swab them COVID negative, COVID negative, COVID negative. And it wasn't that the test was wrong. They actually didn't have COVID. And so I was stuck with the conclusion, okay, well, they've got a cough and a whatever, and it's COVID negative. What is it? They've got the common cold. All of a sudden, we started seeing a cold virus circulating around. And I want to tell you, and so of course, we tell these people this, you're COVID negative, you just have a cold. There's nothing to worry about. All of the more intense worrying about COVID, is it going to get worse? And is it going to develop into whatever? And do I need a pulse? You don't have to worry about it because it's just a common cold, right? Most people aren't worried about the common cold. We're going to talk about that a little bit. What is the common cold? What are the differences of the symptoms and the different viruses and all of that stuff? A common cold typically is runny nose that makes you cough, and sometimes you have a sore throat. Sometimes you have a headache and these, whole cold symptoms, head cold symptoms. COVID, on the other hand, most of the time, it's fever, body aches, and cough. And I've got some numbers for you right here, okay? Runny nose in COVID is only 6% of the time. Runny nose, not very common. You can have a runny nose and have COVID, right? 6% of people do that have COVID, but most of the time they don't. Now, cough, about 50% of people with COVID have a cough, and sore throat is about 20% of people. So cough, sore throat, and runny nose, it could be COVID, but in most of these patients that I was seeing, it wasn't. COVID was either kind of typical body aches, cough, headache, fever. A lot of people had gastrointestinal symptoms, vomiting, diarrhea, abdominal pain. And our numbers over here, this says 11% nausea and vomiting. I think it's even higher in what I saw that was COVID positive, but these are official kind of CDC numbers. Abdominal pain, 7%. That was in the kind of 10 to 20% was GI symptoms. And then the smell, losing sense of taste and smell, that's much more highly likely to be COVID. But so anyway, so a common cold. And so I figured this out. I look at this and I'm like, there's a cold going around. Sure enough, I just looked at the UCSF viral graph. So they swab people's nose and they run a bunch of virus studies on them, looking for all different viruses. And sure enough, the last 2 months, there's been 2 main viruses running around, COVID and rhinovirus. Rhinovirus, what's rhino? Rhinoceros, nose virus. That's what the common cold is. It's a virus that affects your nose and causes runny nose, cough, headache, sore throat, kind of attacks right in here, upper respiratory. That's the common cold. So rhinovirus, it's not just one virus. We've actually identified over 100 different individual viruses that fall under kind of this subtype viruses under rhinoviruses. There may be thousands. These are just the ones we've identified. So a ton of different viruses can cause the common cold type of rhinovirus. So rhinovirus is the number 1 kind of type of virus to cause a cold. Guess what number 2 is in a normal year? It's coronavirus. Coronavirus causes about 15% of cold. Rhinovirus is about 50%. And then other viruses, influenza, parainfluenza, adenovirus, all these other little viruses can similarly cause a cold syndrome. Interesting, right? Like coronavirus is a common cold and then also gets worse. A lot of similarities. Rhinovirus attacks your cells. It directly destroy cells, and then you also have an inflammatory part of it. COVID, it's similar, but it's more severe in some people. Now, so that's the point of the whole video, is that you may have symptoms of a common cold, which could be COVID. More likely could just be a common cold, in which case you would do common cold stuff, which is, yes, you don't want to give it to anybody. I would still wash your hands, keep a distance, wear a mask, like play it safe and everything, but probably don't have to freak out and worry as much as if it were COVID. And if you do have COVID, I still wouldn't freak out and worry. I would take appropriate care of yourself, focusing on, do you have shortness of breath? We're going to do another video talking about when should you go to the emergency department. But I thought that was very interesting, just like coming to this kind of self-discovery, coming to this discovery myself, like a little detective, where it was like, wow, I've got this rapid test. There's all of these negative respiratory infections. And sure enough, UCSF's data corroborates that very similarly, COVID and colds running around. So there you go. There's a little education for you on cold versus COVID symptoms. As always, take care of yourself. Stay safe, stay sane, do your part. We are going to end this pandemic. The vaccine's going to end the pandemic. I'll see you next time.